Welcome back, everyone. Today, we're diving into an incredibly fascinating explainer that literally turns your own body into a diagnostic dashboard. Think about your car for a second. When something goes wrong deep inside the engine, a tiny light on your dashboard flashes to warn you, right? Well, the human body operates in much the same way. It uses our extremities, specifically our fingertips and our nails, as this brilliant built-in biological check engine light.
So I want you to do something for me right now. Hold up your hands and look at your fingernails. Go ahead, take a really close look. What if I told you that the precise angle and shape of those tiny keratin shields could reveal hidden, totally silent secrets about your lungs, your heart, and even your gut? I know it sounds a bit like science fiction, but it's pure medical science. Today, we're going to play biological detectives and figure out exactly what secrets are hiding at your very fingertips.
Here is our agenda for today. 1. Decoding Hippocrates' fingers. 2. The 5 grades of clubbing. 3. Why does this happen? 4. The culprits behind the curve. And 5. Color and structural nail changes.
Section 1. Decoding Hippocrates' fingers, the anatomy of a clue.
This clinical sign is so ancient, it's often referred to as Hippocrates' fingers. And that's because Hippocrates himself was the very first person to document it in patients with severe lung disease. The formal medical definition is the selective bulbous enlargement of the distal segment of digits with subsequent loss of normal angle between the nail and nail bed. Okay, I know that is a massive mouthful of medical jargon. Let's just break it down into plain English. Essentially, we're simply looking for a swollen, bulging fingertip where the nail sits unusually flat against the skin.
Notice the exact visual difference we're talking about here. When you look at normal anatomy, you see that little dip where the nail meets the cuticle? That creates what we call Lovibond's angle. In a healthy finger, it safely sits at greater than 160 degrees. Now compare that to the pathology. In a clubbed finger, that angle just totally vanishes. It dips below 160 degrees, flattening out completely. Check your own Lovibond angle right now. You should see a nice, crisp dip that's greater than 160 degrees.
Section 2. The 5 grades of clubbing. A step-by-step escalation.
This process is a fascinating visual timeline. Step 1 begins really subtly with a fluctuation and softening of the nail bed. It might actually feel strangely spongy if you press down on it. Step 2 is that complete loss of Lovibond's angle we just talked about, dipping right under 160 degrees. By step 3, the nail starts curving downward into an increased convexity, which is often called a parrot beak. In step 4, the entire fingertip swells outward, taking on this bulbous drumstick appearance. And finally, step 5 is where we see something called hypertrophic osteoarthropathy. Now that sounds incredibly intimidating, but it simply means new bone is forming under the periosteum, which is the membrane covering the bone, right there in the finger.
Section 3. Why does this happen? Uncovering the mechanisms. Scientists have actually debated the why for decades, but they've managed to narrow it down to 3 main theories of pathogenesis. Essentially, these are 3 distinct biological pathways that trigger this anomaly. We've got the PDGF and platelet role, the hypoxic bypass, and the neurogenic trigger.
Let's distill these down because they're really interesting. So the crucial point in the first theory is platelets. Normally, large bone marrow cells called megakaryocytes are broken down in your lungs. But in certain diseases, they bypass the lungs entirely, lodge themselves right in the tips of the digits, and release growth factors like PDGF and VEGF. This causes local connective tissue and fibroblasts to rapidly multiply, which literally builds up the fingertip from the inside out. The second theory is the hypoxic bypass. In conditions with a right-to-left blood shunt, think tetralogy of Fallot, circulating vasodilators such as ferritin, bradykinin, and prostaglandins completely bypass their normal inactivation in the lungs. They rush down to the fingers and physically force open deep arteriovenous fistulas. And finally, the neurogenic theory. This one suggests that persistent stimulation of the vagus nerve, which can definitely happen with a lung carcinoma, triggers localized vasodilation in the extremities. So, 3 entirely different pathways, but all leading to the exact same anatomical distortion.
Section 4. The culprits behind the curve. Mapping the body.
This perfectly illustrates our check engine light analogy. The vast majority of causes originate right in the cardiopulmonary system. The lungs and the heart are the absolute primary engines of your body, and when they are compromised, they flash these warning signs straight down to your fingertips.
Let's look at the major villains here. On the respiratory side, malignancies like bronchogenic carcinoma and mesothelioma are prime suspects. We also see it in suppurative or pus-producing diseases such as bronchiectasis, lung abscesses, and empyema, as well as interstitial lung disease and sarcoidosis. And here is a totally startling statistic. Tuberculosis results in clubbing in a massive 30% of cases as a sequela to complications. 30%. On the cardiac side, the culprits include subacute bacterial endocarditis, atrial myxomas, and cyanotic heart disease, which often ties right back into that right-to-left hypoxic shunt theory we just decoded a minute ago.
But our investigation absolutely expands beyond the chest. Gastrointestinal issues like inflammatory bowel disease, so both ulcerative colitis and Crohn's can cause clubbing, alongside primary biliary cirrhosis and hepatocellular carcinoma. Neurological causes include syringomyelia, which involves spinal cysts, and hemiplegia. And then there's this fascinating miscellaneous category, pachydermoperiostosis. This is actually pan-digital hereditary clubbing, meaning for a very rare subset of people, this isn't a check engine light for a systemic disease at all, it's simply woven straight into their DNA.
Section 5. Color and structural nail changes, expanding the diagnostic window.
This head-to-toe mapping shows the body as an entirely interconnected web. We've talked a lot about the respiratory and cardiovascular links, but just look at the endocrine system, the gastrointestinal tract, the hematological system. A problem with your liver, your thyroid, or even your iron levels manifests right at the highly visible ends of your limbs.
We can actually divide these clues into structural changes and color changes. Structurally, you might spot koilonychia, which are these spoon-shaped nails that directly indicate iron deficiency anemia or hemochromatosis. You might see Bowes lines, horizontal ridges signaling a past severe illness, something like pneumonia or pulmonary infarction, or plumber nails, which are closely tied to hyperthyroidism. Then consider the stark color changes. Red nails can actually signal congestive cardiac failure. Blue nails might indicate copper or silver deposits. Black nails can be a severe warning sign of Peutz-Jeghers syndrome, Cushing's disease, or Addison's disease. And stark white nails point toward anemia, hypoalbuminemia, or even diabetes mellitus. Your nail isn't just a piece of dead keratin. It is a living, color-coded health report.
So we return right to where we started. Your body is constantly communicating with you, sending signals from the absolute deepest parts of your internal organs right out to the surface. From the loss of a simple 160-degree angle indicating severe lung disease, all the way to a white nail pointing out a protein deficiency. Next time you look down at your hands, ask yourself, what secrets is your body trying to tell you today? Keep observing, keep questioning, and I'll catch you in the next explainer.